addressed in the webinar. This will be addressed in the webinar. Thank you very much, Nora.
Thank you.
Welcome, everyone, from all over the world, should it be in the morning or in the afternoon or in the evening. Thank you to those of you who are joining us live, and also to those who will be listening to this webinar afterwards. So I want to introduce myself next. I am Jacqueline Surhuc. I am chair of the FIP Pharmaceutical Technology Forum. And next, I am happy to introduce to you this Digital Health and Hospital Pharmacy webinar. I want to tell you this is a webinar which has been organized by the Hospital Pharmacy section. And I praise this section in the name of its president first, Rob Moss from the Netherlands, and of also its webinar committee, and especially in the name of Nora Gerpe, you just heard now, who have put together this lovely program. So we will have three speakers. I will introduce a bit later. Distinguished speakers will address all the topic. Next, I want to give you some announcements first. This webinar is being recorded and live streamed via YouTube. The recording will be available on our website, and you have here the link of the website. You may ask questions. Please use the question box which is provided, and we will try to address this question during the quick Q&A session. You are welcome to provide feedback to the link here, webinar@fip.org. It's important to have your feedback so that we can improve our forthcoming webinars. And finally, if you are not a member yet, you may consider becoming a member of FIP and join us. And you have here the link for more information on FIP membership. Next. So the webinar we are going to present you is completely according to FIP development goals, and especially FIP development goals number 20 on digital health. This is according to the One FIP strategy. It's according to the mission and vision of FIP. The vision, which is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. And the mission, which is to support global health by enabling the advancement of pharmaceutical practice, science, and education, as shown in the next slide, which are the three key components of every digital health goals, every FIP development goals. And I must say that the COVID-19 turmoil has demonstrated beautiful initiatives in all these components of the digital health. Okay, next. So the learning objectives of this hospital pharmacy webinars, which has been put together by the committee, is to compare the European model of digital technologies for hospital pharmacy with the American one, to explain the concept of medication error risk mitigation, and to get aware with medication use technology employed throughout the medication use process. So we will have three presentations, and after the three presentations, we will have the Q&A session, and finally the wrap-up and closing remarks. So this is the overview of the webinar. So the first presentation is from our speaker, José Manuel Martínez Cismero from Spain. José Manuel, you are Director of Pharmacy in Hospital Clínico San Carlos in Madrid. You are also in the position of Innovation Manager at Spanish Society of Hospital Pharmacy. You are the ambassador for Spain at the European Association of Hospital Pharmacy, and you're a fellow of the Royal Academy of Pharmacy. So, José Manuel, we listen to you.
Hello, everybody. It's a really great pleasure to stay with you in this webinar. Thank you, Jacqueline, for the invitation, and thank you, the FIP organization, to let me explain some ideas regarding digital health and hospital pharmacy. Just to discuss about digital transformation in the society in other areas, not only in health, but what can we learn from this digital transformation in other areas in our society. Well, as you know, digital health is growing at a fast pace, rapidly transforming the way healthcare is delivered and how patients and clinicians and hospital pharmacists interact. The recent steady growth of telehealth visits was markedly accelerated by the COVID-19 pandemic, leading to multifold increases in video visits in the span of just a few weeks. The rapid development of digital health products offers timely opportunities to improve health and healthcare, but also may create other problems or low value care. As you know, the term of digital health covers a wide array from hardware and software technologies that includes, but not limited to, mobile health, mHealth, wearables, biosensors and garments, telemedicine, artificial intelligence, web-based analysis, virtual reality, robots, and emerging technologies indeed to improve healthcare services, but also public health, the patient well-being, and they can produce a reduction of inefficiencies. And perhaps the most important, we have the opportunity to personalize the healthcare for every patient. Next, please. Well, this is a sentence from Ayn Rand. She said, you can ignore reality, but you cannot ignore the consequences of ignoring reality. Next, please. But the reality is that we have digital transformations in our daily life. We interact with the smartphone, we can share information, we can buy almost everything with the smartphone, and we need to change the concept of healthcare delivery, trying to implement digital transformation in healthcare services, but also in hospital pharmacy. Next, please. As you know, we are using as society the social media to interact with other people, with other patients, with group of patients, but also we can interact with healthcare professionals, including hospital pharmacies. Next, please. As you know, other areas has been revolutionized with the use of technology. Here you can have some examples how to increase the powerful of the social media, but also new technology in other business models, but that we can learn and trying to implement in a way to the hospital pharmacy setting. Next, please. Here you can have an example. We've been talking about the recent years, if what can happen if Amazon, for example, develop a new way to deliver drugs with the correct information, what will be the position for healthcare professionals? Next, please. But also take it into account that an enterprise like Amazon is building based on artificial intelligence, machine learning services, and so on. Next, please. And this is a great example of what is going on right now in every people's houses. Perhaps you can have this intelligent loudspeakers that can interact with all the population and can learn about what are the activities they can learn about their daily basis, what are the how can you interact with them in terms of health facilities, health necessities for every patient, and that's why we need to change. Next, please. We need to change based on the concept of digital transformation. Perhaps this is the best image that we can use to explain what is the meaning of digital transformation, generally speaking. First of all, is trying to understand that for the best digital transformation process, we need to empower the healthcare professional because we need digital competencies. In the next recent minutes, we will talk about it. But also, it's very important to engage the customers, the patients, because digital transformation and the implementation of new technologies can redefine and optimize the way we work, the way we can optimize our operations in a hospital, in the healthcare system. But in the end, digital transformation and technology, it's only a tool to transform the services and to include and to produce new products, always trying to improve the quality of life of our patients. Next, please. This is a good example. I always remember this picture for a colleague from the British Columbia in Canada, Aaron Sihota, that in 3 years ago in the American Society of Health System Pharmacy Congress, he had an excellent talk related to what will be the value of pharmacies creating patient around the healthcare system in this digital age. What will be the value and the role of the pharmacist or the hospital pharmacist if we compare to Amazon Alexa? That was the beginning of a thinking process about how can we change the process and to redefine the role of the pharmacist in the digital age that we are living in other socioeconomic areas. Next, please. We have some examples, as you know, and I talking about Amazon in convenience with Alexa. They are working, for example, in offering new services to mother and people with diabetes, improving some delivered care, taking into account the importance of data privacy, but this is a reality. So we can have problems if we don't change the way we think about the old way to deliver hospital pharmacy or clinical pharmacy services to our patients. Next, please. And this is, well, very graphic. Some people, for example, Yuval Noah Harari, it's a writer, as you know, he published Sapiens and Homo Deus, and perhaps this is a negative point of view of the human evolution or the hospital pharmacist evolution. Perhaps we can have Homo Deus or hospital pharmacists more related to the great integration of technology in their daily basis. But if we don't learn, perhaps we can find the opposite, the Homo useless or the hospital pharmacist useless from the point of view of the patient. Of course, we have the power to change and to define what will be the new hospital pharmacy profile with digital competencies and trying to implement technology information in our daily basis. Next, please. This is perhaps a positive way of thinking, trying to understand that technology is not only just a tool, and it can give learners, but also healthcare professionals, patients, and the society, the voice that they may not have had before. So perhaps we need to understand that technology is a way to incorporate the patient in the healthcare team and trying to give an active role that kind of new patient that is always living with technology, perhaps not in healthcare system or the relationship with the hospital pharmacy, but perhaps we will have the beginning of a process to use technology and to share and to incorporate, as I said, the patient in a healthcare team. Next, please. So I think that it's very important to dream big, set goals, and of course, take action. Perhaps this is an excellent meeting, an excellent webinar to share some experiences, theoretical ones, but actually practical ones, to learn how can we do this in a better way. Next, please. I think this is very challenging for the hospital pharmacies in our daily basis, but we need to take into account that mindset is everything. Mindset is very important for the digital transformation. In the next minutes, I will have some slides with information regarding what are the key elements, the 20 ways or the 20 key elements for the best digital transformation. First of all, we need to start with the core mission. So we need to start not only with technology, but also try to think about what will be the social value of the introduction of the digital transformation in our daily work. Second, it's very important to be fully committed and accept the pain related with the change, because we all have some experiences and it's very painful, the changing process in the organization, but also for the hospital pharmacy inside the hospital, but also outside the hospital, because digital transformation is very powerful to work from the hospital, outside the hospital, and trying to integrate or work in coordination with other healthcare professionals and other colleagues. The third important thing is show but don't tell, because we have to discuss these transformation ideas to be useful, but getting stuck in and showing evidence quickly, because this way the quickly show demonstration of the evidence will be very important to catalyze the digital transformation. The fourth thing is to be transparent, because this is very important. Collecting wisdom is essential. We need to be open about the success and the failures also, and share the code, share the values, share your plans, be open obviously, and moreover with the patient perspective. And fifth, we need to think broader than web and social, because digital transformation, as I said, it's around the world and in every social economic area. Next, please. Also, it's important, as I said, to integrate and to think or having to account the people learning and the people necessities and points of view. So we need to find someone to guide us with experience outside the healthcare system. Sack the no person, we will find probably some people that are competing or are trying to make barriers to the digital transformation. We need to identify and to mitigate the no person people in the organizations. We need to replace trustees, make sure that there's someone in your trustee board who really get this and educate those who don't. This is very important. We need to break down silos with data regarding healthcare attendance, but also the protection of the data profile of every patient. And in the end, get some good data people, including new kind, a new profile of data, incorporating information not only related with the hospital, but also outside the hospital, the primary care, but also other information that is related with the use of the smartphone of our patients and our citizens. Next, please. But also it's important to redefine the process, because technology give us the opportunity to redefine the process. We need to keep your horizons in a certain, find ways to be innovative, make process more lean, trying to reduce the waste in the process. It is very important to co-design the process with the audience, with the patients, with other healthcare professionals, nurses, physicians, psychologists, and so on. We need to design a new process to be more collaborative, to be more partnerships with people. And in the end, if it's that not work, stop and do it in other way. Next, please. And in the end, trying to understand that tools is very important. Trying to use the technology as soon. We have to learn that perhaps the technology already exists and there is perhaps a low cost for the tools, because we need perhaps only a tool to resolve a problem. The problem is not the tool. So the tool is the way to resolve the problem. We need to understand that we need to go and to move from the cloud base, trying to storage the data in the cloud, but also to analyze in real-time setting the data that is integrated in the cloud. Also, it's important to be modular, not only one size fits all. So we need to adjust and to personalize the digital solution in every situation, trying to track, live the performance, and in the end, make sure that is a new system, a new process that is sustainable in the hospital, but also for the rest of the healthcare system situation. Next, please. This is just an example of industry 4.0, but I think that we can talk about health system 4.0 using these technological pillars. First of all, as I said, trying to protect all the healthcare data from the patients. So we need to take into account the cybersecurity concept. We need to use the cloud computing, mobile technologies, machine learning. Sometimes we can develop 3D printing models for new drugs, trying to use the correct way of robotics and automation in hospital pharmacy. Of course, if we have different data and a big amount of data, we can talk about the concept of big data. We can use the connection of everything, machine to machine or personal to machine, defining the Internet of Things. And of course, we can use other connective technologies of RFID technology, trying to make sure that traceability in the use of drugs is well implemented in the digital transformation of the hospital pharmacy. Next, please. Talking about artificial intelligence, we need to differentiate that artificial intelligence is the general concept, and in the recent years, we've been improving the implementation of the machine learning to define neural networks. But in the end, right now, we are talking about deep learning just to approximate the human thinking to the machine learning thinking, trying to implement the relationship way of thinking of the human. Perhaps this is right now not possible, but perhaps in the next 10 years, we can move on this approximation of the machine thinking to the human thinking. And this is very important, not to replace only some activities that right now humans can do, but also to assist the human, assist, for example, the hospital pharmacy role, trying to improve the necessities and coverage this necessity of the patients. Next, please. This is very graphic in this image. So we need to integrate the automation, the technology that replaces the humans, but also to integrate augmentation. So technology that assists the humans are trying to find the A3 model that generates a new concept that is amplification. So join the technology combinations with assist or replace the human, in this case, the hospital pharmacy role, to an unprecedented scale. So we need to use the positive way of the use of technology on a daily basis of the hospital pharmacies. Next, please. But in the end, the use of technology is based on the use and the improvement of the human talent, the human activity. So we need, as healthcare professional and as patients, to be more aware of the digital competence model. Next, please. So we're talking about to acquire and to learn new competencies based on experience, training, ability, to improve the knowledge, to learn in a different way, to possibility, to give us new possibilities to grow with the new roles of hospital pharmacy. Next, please. And here we can have some person-centered digital literacy for healthcare professionals. First of all, trying to make it possible, new digital safety, trying to have more information and more competence in how we can manage the data information with social media literacies from our point of view. How can we be more aware of the digital concept of digital well-being, trying to teach and to learn and to empower the patients in a self-development way? How can we deal with the digital, the new concept of digital identity, how to communicate, to collaborate with other healthcare professionals, but also with patients, trying to incorporate in the digital healthcare team? How can we use the technical new areas and to increment the proficiency in the new technical activities that we can integrate? And in the end, how can we create and innovate for the new relationship using digital tools with our patients? Next, please. This is very important because, as you know, we've been talking about in the recent years, trying to incorporate the patient-reported outcomes or the patient-reported experience. As hospital pharmacists, we need to work with physicians, nurses, and other healthcare professionals to define patient-reported experience measures, patient-reported outcome measures, but also to integrate this patient experience with traditional clinical metrics. So we need to integrate the scores, the standards, outcomes that we've been using for many years, but also with the new clinical metrics directly interpreted with the healthcare professionals, try to implement and to integrate the information of the economic complete evaluation. So the health economics, what is the definition of incremental cost effectiveness ratio, trying to define new economic models, trying to know what is the impact of the investment in a healthcare result, and in the end, trying to use artificial intelligence to be more predictive. So trying to reach the goal of predictive analytic and to be more active and not reactive, trying to have the best information, the better analysis of the information, and of course, to be a smarter hospital pharmacy integration in all the healthcare system. Next, please. And that's why we need collaboration. We need communication, cooperation. We need to share information for the best integration of the digital transformation model in the hospital setting. What will be the role or the new roles of the hospital pharmacy, trying to be based on new skills, new cooperative ways to define the new teamwork, and very important, try to be more predictive, as I said, and that's why we need digital skills and we need to cooperate and to collaborate with other healthcare professionals. Next, please. And this is not only for the hospital pharmacy or the role of the hospital pharmacies. I think that the world is changing all around. We've been suffering because we are still on COVID-19 experience with the problems with the social protection in our healthcare areas. We've been learning how to define telepharmacy, teleservices, home delivery, that perhaps my colleagues will share with us some information, but in there we are changing. And for this change, we need to change another attitudes and values. Next, please. And perhaps we need to define different models. As I said, we need to add value, because if we don't add value to the new defining processes that are related with digital transformation, perhaps we are losing the train. And this is a pity, because in the end, we all know that hospital pharmacy is a perfect role, a perfect professional that changing the role with the win that is related with digital transformation, we can increase our presence despite the use of telepharmacy. So next, please. We need to experiment a cultural change. This is just, well, it is mandatory, in my opinion, to introduce the digital competence and the digital use in the healthcare setting. Next, please. And we need to change perhaps or to move from the old model that was working, first the culture, then value and attitudes, and then they started to work, to a new model, because right now we are living in a faster society. The way is moving so quick, and we need to change to a new model that is related to, we need to work first. We need to define what we do, why we need this kind of values and attitude, and doing, we think that we can change the culture and then begin again. Next, please. And for example, in this, to share with you some words of a technological leader, that was Steve Jobs. We got to start with the customer experience and then work back toward the technology. So I think this is very useful for hospital pharmacies. We need to have, first of all, the customer experience, and then to decide what is the added value that technology offers to us to improve the quality of life of our patients. Next, please. Perhaps some of you can think that this is just fantasy, but I think that we will have in the next recent years, reality, some example of the best and the correct use of technology on a daily basis of hospital pharmacies. But of course, next please, we need to begin to work, and action is the first step to change things. And in the end, next please, we decide that growth is our way, because change is inevitable. Technology is here. Technology is living with us. So growth is optional. And I think hospital pharmacy are committed to grow, and sharing experience like the opportunity we have today, we will grow all together. Thank you so much. And it will be a pleasure to debate with you in the next minutes. Thank you.
Thank you very much, Jose Manuel, for this very interesting and inspiring presentation. You set the scene with a very wide angle, I must say, and I do agree with you that we should change and grow all together. Well, we will move to the second speaker. Our second speaker is Catherine Miller from the US. So we are crossing the Atlantic Ocean now. Catherine, you are the Senior Director of Acute Care Pharmacy and Clinical Nutrition Services at the University of Kansas Health System, which is supporting over 250 FTE across 5 inpatient facilities in the Kansas metro area in Kansas City. You also serve as a residency program executive that oversees 24 pharmacy residents in 9 training programs. Well, that keeps you busy, I'm sure. So, Catherine, up to you. The floor is yours.
Thank you. Good morning, everyone. I'd like to orient you to Kansas City, Kansas very quickly before I jump into my presentation. Kansas City and Kansas are about smack dab in the middle of the United States, if you're not familiar with us. And a couple of things that are important to the presentation today are we actually are situated on what we call State Line Road, which separates us from Missouri. So we literally can cross the street and be in another state, which sometimes complicates the things that we're able to do with digital health and mobile health, because each state in the United States has different laws and regulations around how we can care for patients and how we can do that electronically. As I begin, I'd also like to recognize my peer, Jason Grunstrom, who has given me some insight. He oversees telehealth and continuum of care for our health system. And so he really helped me expand this presentation beyond just what we're doing in pharmacy. So first, I'd like to share a few patient experiences. Some of these may be very familiar with you, things you've experienced, but a few kind of surprised me as I was learning more about this. So first, everyone today is wearing some sort of smart watch. And we've had several patients who are wearing Apple Watches that alert them that they're having an irregular heartbeat. And that brings them into the ED, and they're able to identify that they're experiencing VFib excessively faster than they would have without this technology. Additionally, we have patients who use remote devices. So they may be tracking blood pressure or glucose or other health information that they're sending into one of our ambulatory clinics. And we had a patient who was no longer, their device was no longer reporting the data on the regular basis that we were expecting. A healthcare team member was alerted to this, reached out to the patient, and actually could not get a hold of them. And so they actually called the police and did a wellness check on this patient. This resulted in us finding the patient down in their home and getting them to the hospital, most likely days faster than anyone else would have recognized that they were experiencing health challenges. Our health system treats patients both in the Kansas City metro and in rural Kansas. And so we use our specialty resources in Kansas City to be able to do telehealth visits. So a neurologist in our Kansas City area was able to evaluate a patient through telehealth and identify that they were having a stroke symptoms and get them to an escalated site of care where they could be treated in an extremely fast time frame. We've all learned a lot with different changes due to the pandemic in the last couple of years. And so we've been able to also send our COVID-19 patients back home with pulse oximetry monitoring that's reported immediately to the hospital. But then we can keep those hospital beds open for emergencies. And this allows that patient to be taken care of in a much safer place while protecting the community and our healthcare providers from coming in contact with that patient with COVID-19. Next, I'm going to drive a little bit into how we use digital health and mHealth in our hospital pharmacy. Most of what we do is not patient-facing on the inpatient setting. And we do a lot of digital and telehealth on our ambulatory side. But when I talk really specifically about our inpatient setting, most of our mobile health is around care team communication. So I have a pharmacist at my main campus. We actually have 3 hospital buildings on this main campus, and they may have patients in all of those buildings. So mobile health really allows them the ability to communicate with the rest of the healthcare team in a way that's encrypted and safe for the patient information, but fast and right in their hand through that their cell phone. We also are able to, as a health system, because we are so large, communicate out things related to emergency preparedness and critical drug shortages or other changes in how we need to care for patients much more fast than by sending emails. So everyone's connected all the time, and there's typically communications that come out on a regular basis that can impact how we care for our patients on the inpatient setting. As I expand next into how we evaluate our patients and take care of them in the health system pharmacy, my director told me when I started working at the University of Kansas Health System that we need to prepare the patient for the next person who's taking care of them. And that's really our customer. So as we've expanded how the pharmacists across our healthcare setting, really that next customer tends to be another pharmacist who's taking care of the patient in the ambulatory setting in a clinic appointment. So we're able to really collaborate between our pharmacists through some of our digital technology, through our electronic health record, and through some more real-time communication. Our patients have an ability to request medications via an app. We try to set them up with this app when they're in the hospital, and then that allows them the ability to continue making sure they're getting medications on a regular basis when they leave the hospital. And I'm sure as many of you experience, one of the first things that we've really seen digital health impact our patients is through remote blood pressure and glucose monitoring. This may be on a daily or more than one time a day frequency, but the data that the patient's collecting at home, they then send into an ambulatory clinical pharmacist. And we have clinical pharmacists who have collaborative practice agreements. And so they're able to real-time adjust those patients' medications without having the patient need to come in and see a physician. As we look next, I'm going to talk about how we've really expanded things through our health system. One of the most exciting things, I think, to help engage our patients be really active members of their care team is that they have access to their medical records and clinical notes immediately after the provider signs them. You know, sometimes we have really fast conversations with our patients, and this allows them to really see the nitty-gritty of what's going on and how the providers are taking care of them, and ask questions immediately in that moment. It helps them really be active in their care and make sure that we're making the best decisions for them, whether they're in the hospital or leaving the hospital. I also mentioned that we have health systems or hospitals as part of our health systems that are out in rural Kansas. So in my hospital and health system, I have about 85 pharmacists that are working. And one of our hospitals out in rural Kansas has 3. So I actually have 3 infectious diseases pharmacists specializing in that, and they only have 3 pharmacists that take care of all of their patients. So one thing that's been really helpful as we've integrated our healthcare is if they have a patient that has a unique infectious disease process happening, they'll just call up my pharmacist at my hospital who has that infectious disease training, who can look at that patient chart and within 15 or 20 minutes have a really good recommendation for that patient back in the rural hospital. The pharmacist in that site may have had to spend a couple hours digging in to understand the patient and do some more research on those drugs and their the disease that we're trying to treat. And so by providing this quick interaction and clinical consult across the state, we're really providing better care for all of our patients. One thing that really surprised me and resonated as Jose Manuel was talking about what's the reality and what's virtual reality, we are now able to see, we have 3D MRIs. I just heard recently about a patient who had a cardiac problem, and their physician had them literally put on 3D virtual reality glasses and walked them through their heart. I'm like, oh my goodness, how cool is that? And how we can really help patients see what we are doing to take care of them and help them understand how we're impacting their care. On the next slide, I'm going to talk really quickly about how the pandemic impacted our health system. So everyone has been trying to expand telehealth, probably across the world over the last several years and months. And there are a lot of challenges to implementing that. I mentioned that every state in the United States has different regulatory requirements for licensing for healthcare providers and for how we take care of patients. And previous to the pandemic, it was hard for us to take care of our patients who lived in Missouri because that means we were practicing across state lines, and most of our employees only have Kansas licenses. So pre-pandemic, our organization was providing 100 telehealth visits per month. That's about 3 per day. The pandemic helped us push forward a 2-year telehealth implementation plan and put it into place into 2 weeks because of some of the relaxed financial and licensing challenges due to state and national emergency orders. And today, 18 months later, we're providing 1,200 telehealth visits per day. So this has really expanded and streamlined how fast patients can get into their healthcare appointments. As I look even further beyond our hospital walls, into expanding healthcare kind of outside, I'll go on the next slide. Some other things that we've experienced that are able to help keep patients out of the hospital. We have ambulances now that have cardiac leads that connect via Bluetooth and can send that cardiac information into a provider at the hospital who can help the ambulance crew decide if that patient needs to come into the hospital or not. Think about the savings on both the expense for that patient, having someone in our hospital bed that doesn't need to be there. Very similarly, we can have ultrasound wands connected via Bluetooth. So all these things are helping our healthcare providers who are outside the hospital really determine whether or not we need to bring that patient in, or if there's a better place that we can take them to monitor their care. I've already mentioned glucometer and blood pressure monitoring. That is probably where most of us started to see the digital health movement. And our organization is starting to talk about something called hospital at home. Certainly you have to be a less acute patient but potentially still need some monitoring, either your blood pressure, your heart rate, your pulse oximetry. But we're finding ways to keep patients at home. We all know that it's a stronger healing environment for those patients. They're being poked and prodded less. They're probably much more comfortable. And so we're continuing to find ways that we can use digital health to allow those patients to be taken care of at home. One of the big questions that I've had and that we've had at our organization is, what are the challenges that patients have to accessing digital health, telehealth, mHealth? These days, especially in America, nearly everyone has a smartphone. And so this is really, they're free apps that you can download for everything that I've spoken about so far today. And even within our first week of telehealth, we had a 99 and 100-year-old couple who were able to set up and access telehealth appointments immediately. They had no technology problems. Now, I also know that there are 20-somethings that have challenges with technology, so this may not be everyone's experience, but I think as this becomes more common and everyone is having cell phones or mobile devices constantly, this is going to be a lot easier for patients to access. The other thing that's been really exciting is the ability to schedule appointments within minutes or even ask questions to prevent a visit. So myself personally, I thought I had strep throat, and normally that would have taken me maybe even a day or two to get into an appointment where I could get in and get tested and determine if I needed antibiotics. I literally logged into my health app and said, I need an appointment. And within 15 minutes, I was on the phone with a physician who said, yes, we need you to come in and get tested. But I was able to go into the lab and get tested and not have to spend my time going into a physician appointment. And so there's a lot of opportunities for us to improve care. The other thing that I'll mention is I was talking to one of my behavioral health peers, really by increasing access to care for our behavioral health patients. If a patient has anxiety, it's sometimes hard for them to get out of bed, let alone get in their car, drive to the hospital, navigate a health system as large as ours, how many people they might encounter on the way. And so that's really going to deter that patient population from getting their health care. And so by having this telehealth appointment and these digital health visits, that patient all they may have to do is sit up in bed and turn on their cell phone, and they can talk to their provider and get some additional help to continue to improve their mental health. So we're continuing to see increasing access to care. We're continuing to see increasing quality of care and access to the specialists. We're providing patient care in the most convenient and safe place for those patients. And we're continuing to improve sharing of health data among hospitals and health systems. I think each of these continue to have opportunities for us to grow as healthcare providers to continue to take the best care of our patients. And I think based on what we learned from Jose Manuel, there's a lot of opportunities, and we're still learning the skills to get there, but we've seen some great improvement in the last couple of years. So thank you for the opportunity to discuss what's happening in Kansas City, Kansas.
Thank you very much, Catherine, for this outstanding presentation. It's exciting to see the opportunities that are offered by those technology developments. Really very lovely. Thank you. So we are moving now to our next presenter and third presenter, Jolie Audinet. So Jolie, you are PharmD and you completed a PG, a postgraduate year 1 pharmacy practice residency and a second year in health systems medication use management residency at the University of North Carolina Medical Center. And presently, your current research and practice interests include medication safety and quality medication use technology, trigger tool development, and as you say, just culture. So we are listening. Let us listen to your just culture. Thank you.
Hello, everybody. I'm thrilled to be here today to discuss with you medication use technology within hospital pharmacy. I'd like to get us started today by briefly reviewing the role of human factors in medication error risk within hospital pharmacy, and then transition briefly into discussing the role of digital technologies to support medication safety within our everyday practice. Now, before we can discuss how various technologies are implemented to enhance patient safety, I think it's important that we understand how errors occur. Across international lines, we have several things in common. We are by far fallible humans who operate within imperfect systems. I think this is important for us to remember. Our hardware is prone to malfunction, and we often have opportunities to increase efficiency of our own workflows. There are multiple reasons that human errors can occur, from exhaustion to distraction, memory lapses, or even ineffective training. In this diagram, you can see that human errors are often just the first step in a chain of errors, followed by latent errors, which are holes or gaps in processes, unworkable procedures, or even miscommunications of expectations. The Swiss cheese model that you see here on the slide was developed to depict this exact theory. Our cheese slices are redundant layers of protection set up throughout the medication use process, intended to block errors from reaching our patients. In each slice of Swiss cheese, you'll notice that there are variations in the holes, which stands for failed defenses. Unfortunately, if these holes line up, the potential for an error to reach our patient grows exponentially. Now, to answer why medication errors are so common, on this next slide, I think we need to look no further than our very own complex healthcare system. Taking a step back to focus on the entire medication use process, interestingly, I think you'll notice that most serious errors in the literature are documented to occur in the ordering step and the administration step. And so, luckily, digital health technologies offer protection against many of these types of human errors. Today, we will be focusing on implementation of CPOE, or computerized provider order entry, and we will also focus on electronic health records towards the left-hand side of your screen. Together, these have led to over 50% reduction in human errors, ultimately enhancing patient safety. On the next slide, you'll notice that many institutions now use electronic health records as mandated by many regulatory bodies, which offer the capability of computerized provider order entry, or CPOE. Now, to span across the continuum of care, there's even an app that many EHRs offer. Epic Hyperspace, or Epic Haiku, is the one that my institution uses, and so I've pulled a picture for you to see. One of the major benefits of CPOE is the ability to build clinical decision support systems. These offer alerts or prompts to clinicians based off of drug disease, or even allergy contraindications. Your institution may also create care pathways or order sets which combine medication, nursing, and procedural orders, and even standard of care recommendations or stepwise approaches to de-escalate therapy. As mentioned previously, this technology alone has eliminated transcription errors. So many of you can likely relate to the difficulty in deciphering messy handwriting from a provider, as shown on the right-hand side of your screen. Most importantly, since it is not humanly possible for us to memorize all drug information and updated literature, defaulting drug information within a CPOE system allows institutions to standardize the way we write medication regimens, standardize the concentrations that we stock within our hospital pharmacies, and standardize how we dose certain antibiotics or certain neuromuscular blockers, which ultimately reduces clinical variation amongst our patients and enhances clinical outcomes. One of the best ways to demonstrate real-world applications of human factors engineering is to review ISMP's best practices. Internationally, ISMP, or the Institute for Safe Medication Practices, is recognized for publishing their best practices for hospitals and various clinical guidelines to optimize your technologies. So here we can see that ISMP urges within your electronic health record to default a weekly dosing regimen for methotrexate and require a hard stop for verification of oncologic indications. So within your CPOE system, order sets offer an easy way to do this. On the right-hand side of the screen, you can see stop signs or hard stops, which require a provider to answer certain questions prior to signing an order. This allows for two things. First, it allows your pharmacist to more easily double-check correct dosing regimens upon verification, because all of the necessary information is there on one screen for you. But secondly, this enables indication-based prescribing, which is the way we're moving for many of our high alert or high risk medications. This allows all staff and all of your patients to know why a medication is on board, directing a bit easier medication reconciliation process across transitions of care. On the next slide, you'll see an example of this medication reconciliation feature. Now, this is often used in many American healthcare systems, but I think we can't fully appreciate the capabilities of this feature without acknowledging where we came from. So on the screen here, I've inserted a bit of a play on words. This unfortunately resulted in a med rec for our patient. As you can see, there are two opportunities for the way that this medication reconciliation technology feature is set up. Humans are not intended to read in caps lock or all capital letters all the time. Unfortunately, here you can see all medication names are caps locked. I think this drives home the importance of using tall man lettering, which is another ISMP recommendation. The second opportunity here is to further space out your dose from your strength or concentration. If these are too close together on the screen, the human mind can sometimes, unfortunately, interchange these numbers, which can result in dosing or omission errors. The last feature that I would like to discuss with you all today on the next slide is reporting and trigger tools. Keep in mind that technologies enhance the human mind. We can never fully eliminate clinical judgment. And so designing your software features is very important to keep in mind how humans interact with these technologies. Studies have found that only 10 to 20% of errors are reported voluntarily. So we really need other methods to identify potential patient harm. Triggers are occurrences or prompts. You can think of them like flags found to help review a medical record and trigger an investigation to determine the presence or the absence of an adverse event. The IHI, or the Institute for Healthcare Improvement Global Trigger Tool, is a guide for reviewers in conducting these manual retrospective chart reviews. One example of this can be found on the left-hand side of your screen. However, it is critical to flip the script somewhat, and I challenge each of you to think about how we can make this more prospective. On the right-hand side of your screen, you can see a hot topic in hospital pharmacy. This is actually a risk stratification mechanism that was built into the EHR to prospectively identify patients at risk for readmission. So you can build an algorithm in the background of your patient list, which identifies and stratifies patients at risk of readmission. This then classifies them as a red dot or high risk, a yellow dot as intermediate risk, or a green dot as low risk of readmission, prompting your pharmacist to make interventions earlier. The first step is often to prove that you have a problem within your institution. Unfortunately, we cannot improve what we cannot see. On the next slide, I'd like to share with you all a success story of an institution that converted manual trigger tools into an automated trigger tool based on hypoglycemia. So Barnes Jewish Hospital in the US successfully reduced their hypoglycemia occurrences inpatient by 78% by building an automated trigger tool that identified patients at highest risk for hypoglycemia. This took into account multiple risk factors such as low weight, female gender, liver dysfunction, history of hypoglycemia, or high dose insulin regimens. This would alert the care team that this patient was at high risk of hypoglycemia, so they could, number one, more closely monitor the patient. Number two, ensure antidotes were on the patient's profile and readily accessible. And number three, prospectively reduce the doses of their insulin regimens to avoid harm. This is a lovely success story and something many healthcare systems are now adopting as well. So on this last slide, I like to wrap up my pearl with a discussion of metrics. How do we know that we are safer today than we were yesterday? Reporting medication errors and error investigations can actually be quite tricky. I think it's most important to track and trend actionable data and communicate why these are so important to your staff. So you may choose to do this reporting through your electronic health record, or you can even use a third-party platform which pulls together metrics from multiple different technologies. Here's an example of a third-party software which pulls metrics together from an electronic health record and from a smart pump vendor. On this initial screen, you can see a variety of different reports that can be generated with the click of a button. So for example, I can choose to see alerts generated over a specific time period, which could be divided by drug. It could be divided by nurse action that they took at the bedside, or even divided by what time of day they occurred. Keep in mind that the metrics I measure at my institution may not be meaningful to you in your practice. So my recommendation is to start small with 1 or 2 goals. First, determine what core values your practice area has. Translate these into measurable, actionable data. Set clear expectations of how you would like to improve with your staff, and then share these tracking and trending measurements regularly with frontline staff to gain their buy-in. Eventually, you'll be able to switch these metrics from manual tracking to prospective tracking and help reduce patient harm and enhance patient outcomes. In summary, what I would like to leave you all with is to consider human factors when assessing medication errors, when designing or implementing new technologies, and/or monitoring for practice drift or workarounds. Reassess your technology features regularly using plan, do, check, act, or quality improvement type theories. If you are a frontline staff member, I think it's important for you to ask to get involved prior to implementing a workflow to make sure it works in your hospital pharmacy. And if you are a leader, please reach out to the folks actually using the software to get their input. This will make frontline staff buy in to the extra steps or maybe extra clicks you're asking them to do for patient safety. Lastly, continuously remind staff why you are doing this. Include technology strategies and the importance of compliance in your new hire and annual staff education. Thank you all.
Thank you, Jolie, for your lovely presentation. It was very interesting and you presented it in a very didactic way. So thank you so much. Well, I think we had a very good set of presentations, and I will turn now to the questions of the Q&A session. Then we have some interesting questions to address. So one of the questions I have seen is how to overcome the problems when you have no access to resources to digital technology. This has been addressed in 2 or 3 questions. Who can answer that? It's a difficult question.
Yes, it is very difficult, of course, because we are talking about digital transformation, try to implement new technologies, but of course, if you have no technology, it is complicated. But I think that the key element here is trying to think that to begin the walking process, to go step by step, and to with easy technology, cheap technology, trying to use a smartphone, for example, for the patients. Perhaps you have the perfect electronic clinical record in your hospital or in your healthcare system, but perhaps you can find a way to engage the patient only with the technology they have, and you can connect. Of course, this will be a problem, but I think that I said dream big, the big thinking process, but sometimes the reality is reality, and you need in a smaller step and trying to use technology perhaps from the point of view of the patient, not the system.
Yes, it is true. You mentioned the smartphones, because even in the developing countries, almost everybody, let's just say, has a smartphone. So how can we begin from the smartphone to implement something very practical in our hospitals? Not easy question either.
I would suggest to just start talking about it. You know, often if we request resources in our health system, in our organization, they don't get approved the first time we ask for them. There are so many competing priorities. And so the best you can do is just get it on the list and start talking about it and start talking about the benefits. Get some data from other organizations like Jolie shared, and give examples of safety events that occurred in your organization that could have been prevented if you had the technology. But the best you can do is just start talking about it so that more people understand and can ask questions. And so when it is coming to the top of the list and there might be funding available for it, it won't be the first time that your executive team is hearing about it.
Jolie, do you want to add something to that? Your presentation was very practical. So let me phrase the sentence in a different way. If a developing country was coming to you and asked for your help, saying, well, I just have a smartphone, what would you suggest?
So thinking about hospital pharmacy practice, I think one of the easiest things for my institution to implement was actually barcode scanning. So this is, of course, not necessarily as patient-facing as Catherine or Jose's presentation, but this drastically helps to reduce right dose, right medication, and right patient type errors. There are simple plugins that you can buy for the bottom of a smartphone, the bottom of your iPhone, that can read barcodes and ensure that your hospital is dispensing the right medication to the right patient. And you might only need 1 or 2 of these for a health system to operate.
Very informative. Thank you to tell that. We have other questions, and I have a question here about manpower. That was raised during Catherine's presentation. And the question included, have to juggle OPD and rounds with IT-related work. Catherine, I think you have already answered that question, at least in the chat box, but would you extend a little more?
Absolutely. I'm very fortunate at my organization that typically when I ask for resources, we're able to get additional positions to take care of our patients. One of the challenges we're having right now is finding qualified healthcare providers to come work in our organization. I mentioned very briefly that the pandemic has had some really impactful outcomes on healthcare providers in the United States. And there are a lot of healthcare providers who are leaving healthcare entirely. And so that's some added challenges right now. But very specifically to how does the information technology and the opportunities that we have there and the impact on our pharmacist work. You know, we often think that we're adding technology and that it is going to make our job easier. And often it doesn't. It may make our job safer. It may provide additional information to the patient, but often it adds extra steps to the work that my pharmacist or pharmacy technician are doing in order to get to that safer place. So I think it's really important to have that conversation and to evaluate the technology and understand if that benefit is how it will impact your workforce. There's definitely things that we have implemented to take care of our patients that, you know, do complicate the work that we do. Jolie mentioned monitoring glucose. We have these great trackers that are built into our electronic health record that help a pharmacist evaluate how that patient's glucose has been over the last couple of days. But if you don't go look for it, it's not going to tell you that information. And don't forget that you also have one that's monitoring their blood pressure, and you also have one that is monitoring their sedation score. And so we create these tools that are very helpful, but it does increase the amount of work the pharmacist has to do to keep them all in their mind and monitoring them and ensuring that they document, that they assessed the information as part of taking care of that patient.
Well, thank you all of you. Shall I turn to Ruben to have a summary of the other questions? Ruben is a FIP staff who is helping us in the questions.
Yes, Jacqueline. So far, I don't see more questions.
We have all addressed. I think some questions have been addressed in the chat box already, in the question box already. So I would like you to turn to José Manuel, because you mentioned this Amazon Alexa possibility and Alexa possibility. It is this voice assistant. Recently, Amazon launched a new possibility for monitoring the elderly people, the seniors. I don't know if you have seen that. It was launched last week. And I would like to have your feelings about this in the view of competing with pharmacists.
Okay, this is very well. It's a key question, of course, and as I said in Congress in US, we've been talking about this. For sure, this is a reality. So we need to design the future by changing our perspective. First of all, I think that we need to stay in the design of these new tools. So defining algorithms or, for example, chatbots and these kind of new tools. This is the first step, to stay with bioinformatics and so on, who is designing these new tools, and then to change the profile, taking into account that the humanity role is still not well covered by machine, but we need to complement this activity, having presence with new technologies. So perhaps this is very important for, how to say, the immediate necessity of a patient having a question and having the machine with the covered algorithm. But it's very important to have your healthcare professional facing with you in a scheduled time and trying to review, how to say, medications, trying to identify adverse events, trying to define complementary models, changing between telepharmacy, for example, or a chatbot or a loudspeaker with technology, but always having the presence of a pharmacy, because if not, we are in danger to lose one of the main areas of our activity that, because we've been doing for so many years, we don't perceive that we need to use new technology, because in the end, uh, the first barrier in every change is the personal barrier, and is human resources barrier. So this is the first step, to identify that we need to move to digital, to have presence in a different way, and always doing things that not yet the technology is not able to do. But we don't know exactly in the future what is going to happen. So be ready for all the changes.
Well, thank you, thank you, Jose, for this answer. I was a bit struck in your presentation. You mentioned you must be ready to accept the pain. And
Yeah.
this is very, somewhere, it's very emotional to accept the pain. And I understand this is the resistance to change, which is widely described when we are asked to change something we have done so many years along. Then you said, well, it's a disruptive thing. You have to change, and it makes you pain. So yeah.
This is very important in leaderships, in changing process, because first of all, if you don't feel pain, perhaps it is not a disruptive transformation. But the opposite or the alternative is not to, how to say, to put your hand in your eyes and to avoid the reality, in terms of the sentence I've mentioned of Enron. So we need to accept that this is the present, this is the future. So we must change. And we must change for the patients and for the transformation, the metamorphosis of the role of the pharmacist and the hospital pharmacist too. And perhaps this is very important in Spain. We have a low level of collaboration with community pharmacy, and technology is putting the right technology, the best scenario to promote this collaboration. This is a way to advance. And for me, it's very, very challenging, because if we coordinate, in the end, the healthcare results, the healthcare outcome in every patient, it will be better. I am very confident about that, but technology is a tool. So we need to decide what will be the assistant of technology, sometimes the replace of the human part. But right now we need to design and to plan, because if we continue the same, somebody will have the plan and perhaps this is not the best scenario, not only for the patient, but also for the hospital pharmacist.
Yes, hopefully it will be that way. But I see a question in the discussion box, somebody who is saying we are facing the challenge of lack of availability of those programs combined with electrical failure, which forces us to go back to manual management. So this means that there is a long way to go forward.
There is.
And also, even in a developed country, things can happen, but you have to go back to manual management. So you must be very adaptable when you change those technologies.
For sure.
Ruben, have we addressed all the questions, or is there a pending question somewhere?
Yes, I don't think so, Jacqueline. Maybe we can also ask the speakers for a couple of summary points and move towards the closing.
Okay, I would like to ask another question. We have been talking about pharmacists. I would like to see now the angle of view of the patient. Is there any risk for a patient who would like to engage in digital health? Who would be ready to answer this question? Maybe Catherine?
Sure, I can start. I think, honestly, there's really a lot of opportunity for patients. And I think there are so many benefits that we've mentioned today that will be helpful for our patients. Being able to get healthcare in their home, not having to travel, not needing to find someone to drive them to the hospital or to their clinic appointment. I really see a lot of benefits for our patients in how we enhance digital health, as long as they also have the resources in their home to do that. So certainly the mobile health through the cell phone technology is really important. I think that the risk of not having the technology resources on the patient side, or as mentioned, electrical issues and on the patient side can also be really challenging. I think the other risk to patients is there are things that we can't do during a virtual visit. So, even reflecting on my experience of when I thought I had strep throat, the provider was like, well, I can just give you an antibiotic for that. And I was like, oh, I'm a pharmacist. I want to make sure I actually have strep before I start an antibiotic. I don't feel comfortable with that. And so I went in and got a test. And so there's things that are, that's a risk, is how we make decisions for our patients when sometimes they should get a lab test before we make that decision. And so making sure that our healthcare providers have those tools to determine when we need to make sure a patient comes in and getting them in, and when digital health and telehealth is not enough for their care.
Very wise. Thank you very much. Well, we are almost at the end of this webinar, so I would like to have your concluding remarks and other thoughts, if any. Maybe I begin by Jolie.
Sure. It was an absolute pleasure to speak with you all this morning or this afternoon in your own countries. I think Jose and Catherine and I are all hinting towards the same thing, that we need to be culturally ready for a shift in patient care in order to reduce clinical variation and enhance patient safety. First, we need to ensure our staff, our pharmacists, our technicians, our providers are ready to embrace digital technology. This includes taking into consideration your patient's health literacy levels. If you do have automatic progress note release, I think Catherine hinted towards this. We have the same thing here in Louisiana. Be sure that your patients are also ready to embrace the wealth of knowledge that's about to come towards them. If you are culturally ready for this change, if you know where your compass is pointed towards true north, identify a few goals and a few areas that you really want to beef up within your practice, trend these, have transparent communication with your staff, you'll be set up for success.
Great. Thank you very much. So, Jose Manuel?
Okay, in my opinion, I think that digital transformation is one of the best ways to stay close to your patients. So it is not to stay away, it's a way to have more knowledge of your patients, to integrate your patients in the healthcare team. So we need to increase the awareness on every healthcare professional to use new digital tools and to improve the quality of the healthcare services, including, of course, hospital pharmacy services in coordination with other healthcare providers.
Thank you, Jose Manuel, for this very thoughtful conclusion. Thank you very much. And Catherine, you have the last word.
Thank you. I think Jolie and Jose Manuel had great endings. The takeaway that I would leave you with is our patients are ready for this. They're asking for this. And I think the pandemic has proven that to us. And so it is our job as healthcare leaders to get our healthcare providers ready for this change and to prepare them for it. It's going to be only us standing in our way of success. The patients are ready.
Thank you, Catherine, and thank you for all of you for your outstanding presentations, which have been so inspiring for the audience. I can see in the chat box all the congratulations for all of you. But the last word I would like to give it to Nora, who put this program together. Nora, are you here? We cannot hear you, Nora. You are muted.
Thank you so much, but it's too much responsibility for me. Just once more, I think that the webinar was great. Thank you for all of you. Thank you.
Well,
Bye-bye.
You are the author of the program. So the congratulations go to you and to the hospital section.
Thank you.
Okay.
Bye-bye.
So thank you to all of you. Thank you to Ruben and Gonzalo who were behind this webinar. And bye-bye to all of you. Bye-bye.
Bye.
Bye-bye.